Hello and welcome. My name is Katerina and I'm the Senior Programming Associate at the New York Immigration Coalition, and I will be your host today. The NYIC has put together a series of videos to connect immigrant New Yorkers to city services that support families' economic, educational, and social development. Today we will be hearing from Maha Attieh, a New York State of Health lead navigator at the Arab American Family Support Center. We will discuss how to navigate the healthcare marketplace, more specifically how to access it, create an account, eligibility requirements, and more. Now I'd like to introduce Maha Attieh.
Hello, my name is Maha Attieh. I'm New York State of Health Lead Navigator at the Arab American Family Support Center. And I'm here to help you access the marketplace and to get health insurance.
Great. Well, thank you so much for joining us today, Maha. We'll go ahead and jump right in. So since you are a health navigator, what exactly is a health navigator and what do they do?
Okay. First of all, I just want to say thank you to New York Immigration Coalition and to you, Katrina, for having us to help our community members and new immigrant populations how to access the health insurance benefits. Now, being a New York State of Health Navigator, we are certified people who can help the people of New York State to apply for health insurance. Navigation does mean we help you step by step apply and to process the application for you in your own language and choose the right plan that fits your need, because we are certified and we have the experience to help you go through the process of applying for health insurance.
Any information that I share with you, is that shared with anyone else?
Okay. When you give us your personal information, only me and the New York State of Health will see it. There is no any other agency will see your confidential and personal information. And when you apply with us, if we need to upload documents, we upload it. If not, nobody else will see it. When you come to us, you share the personal information to process your application, which is very important for us to use your personal information, and nobody else will see it. It's all confidential and free services through the marketplace.
That's great to hear. I know that that's certainly a question that we get a lot too, and a concern that a lot of people have.
We will never share it with any immigration department or police department or any other governmental agency. It's all between us and the New York State of Health.
Yes, and that is definitely something we want to emphasize and highlight here today. Jumping right in, so what is the healthcare marketplace and how do I access it?
Okay. When we say marketplace, it's a place where you shop for a plan for health insurance. Just like you're shopping for clothes or food, you need something that's healthy for you, something that fits your need. So shopping for a health plan is not easy, but we go by your doctor, what they accept, and that's when we advise clients which plan that fits your need, fits your budget if you are eligible to buy a health plan.
Okay, that makes it seem a lot less overwhelming. How do we access it? Where do I go to access the healthcare marketplace?
If you have a computer, you could access it anytime. You log into NewYorkStateOfHealth.gov and you log in. But if you find it very difficult for you to apply on your own, the site will have information to find someone like navigator or assessor to help you in your own language, in your own zip code. So navigators are there to help you process the application in your own language. Will make it much easier for you to process it, because so many questions and complicated follow-up questions on the application. Some people, they get so confused, they don't know how to process the application. Sometimes from the first page, the system will ask you to identify yourself, which they need the proof of your ID or passport or something to identify you, which we are trained and we are certified to do that on the spot if they come to us. But if they do it on their own from home, they need to fax it or submit it by mail. It might take 1 week to 2 weeks, over 10 days for them to process the application. That's what's very important for them to connect with a navigator to help them on the spot and do the process of the application right away.
it definitely seems like that's the easiest way and probably the fastest, right?
Yes, it's faster. And when they come to us, we explain the whole process.
All right, great. If I'm ready then to go ahead and create an account, what information do I need to share with you?
It's very important, as I said, to share your personal information just to see your eligibility. We need your name, date of birth, social security number, if any, address, phone number, and your income. Because depends on the income and the family size, that's how we determine which program you are eligible for. Which is very important to share this information. If you have social security number, we could identify you, identify the income you have, where you work, and we could confirm this information with the pay stub you give us and or taxes to prove your income level. It's very important to know your income level to see are you eligible for Medicaid or essential plan or qualified health plan, which they call it Obamacare, because you might be end up paying for it. So if your income very low, many of our immigrant population, they just start working, they have very low income, they might be eligible for Medicaid or essential plan. Now, we the only state that we give essential plan for our green card holders and work authorization holders. That's why it's very important to know what's your immigration status. It's not for us to keep or to share it with somebody else, just to know what's your eligibility, which program you will be on. And remember, health insurance through the marketplace, either for the adults, either you are on Medicaid, essential plan, or qualified health plan. The children, they are eligible for Medicaid or Child Health Plus. Again, it depends on the income, family size, and the immigration status of the children. New York State of Health is so great that they're giving all children in New York State health insurance coverage, either Medicaid or Child Health Plus program. So many parents, they didn't know they are eligible for Child Health Plus, even undocumented children, up to age of 19, which is a great benefit for children in the schools. They didn't have to pay to access healthcare for their children or immunization or annual checkup in order for them to be in the schools.
Wow. So one of the things that you mentioned was that green card holders are eligible to receive health insurance. So I wanted to take that more generally and ask, is everyone eligible for health insurance?
Yes, yes.
Regardless of immigration status?
Yes, green card holders and work authorization or any documents that make them approve call cases with immigration, they are eligible for coverage for health insurance. And that's how we give them essential plan. Okay. And depends on their income, they could be paying for health insurance if they have high income. So not necessarily they just get an essential plan. They could be on the qualified Obamacare plan.
That is definitely something that we want to emphasize today, which is that everyone, regardless of immigration status, is eligible for health insurance. And we definitely encourage you to reach out to a health navigator to learn exactly how to do that.
Yeah. I would like to mention the undocumented. If they come in with their foreign passport to us, they are allowed to apply, especially in New York City. They will be getting emergency Medicaid, and we can refer them to the program for New York City care in the public hospitals, which they will be allowed to have their annual checkup. It's not coverage, but at least they will have emergency Medicaid. In case they got admitted in a hospital, their medical bills will be paid in the hospital through emergency Medicaid. Okay? So it's very important. We didn't turn no one away. It doesn't matter what's your immigration status, especially if they have children. They could be on Medicaid or Child Health Plus, depending on the age and the income they have. So it's up to the parents if they want to be enrolled in emergency Medicaid, and we'll be happy to do that for them and refer them to different programs in the city.
Yes, thank you for detailing exactly what coverage you can get as well. That's incredibly helpful.
And one more thing, being a navigator, we are statewide navigators. Not like the assisters for a plan, they only within the county. For me, I'm enrolling people in the 62 counties in New York State. And which people, they reach out to us, especially being a New York State Health Navigator, the Arabic speaking one. People who speak Arabic, they reach out to me from all over the state, which is great to reach out to a navigator who speaks their language.
Yes, and that actually leads me right to my next question, which is, If I don't speak English, is there interpretation or translation support available to help navigate the healthcare marketplace?
Yes. Yes. So anyone who log into the site, or they could call New York State of Health at 1-855-355-5777, and they could request to speak to someone in their own language, or they could call me directly, and we could refer them. And we have actually in our agency staff who speak over 30 languages, and the New York State of Health, they have people who could help in over 30 languages.
Amazing. So you encourage then people to go ahead and call this number and
Yes.
request a language support.
Yeah. Or they could call me at my direct number, and I'll be happy to assist them and help them. And we don't
Yes.
turn no one away. We help anyone. It doesn't matter what language they speak.
Thank you, Maha. And we will be including your contact information at the end of this presentation as
No
well.
problem.
All right. So then for my next question, something that we hear a lot are people that are worried about public charge, and they're concerned that enrolling in the healthcare marketplace puts them at risk. Is that true?
Public charge doesn't affect enrollment in health insurance. People, they have to know that they shouldn't fear to access healthcare or to access health insurance through the marketplace. Public charge doesn't affect your citizenship. Anyone citizen, they're eligible for health insurance. Green card holders, they're eligible for health insurance. So health insurance is a benefit that you are entitled to, and you have the right to access healthcare with health insurance. Do not fear to apply for any public health insurance in New York State.
Okay, great. Thank you so much for emphasizing that. All right. My next question for you is, what is open enrollment and when does it start?
Okay. Now, open enrollment through the public health emergency COVID, it was open all year round. But now, since the public health emergency ended in May, we're going to go back to open enrollment on November 1st. In New York State, we have it from November 1st to January 31st. Everyone, any new applicants, they need to apply for a new health insurance through the marketplace. They're allowed to call us from November 1st to January 31st. Now, if anybody has existing application and they have the qualified health plan already, which is going to end December 31st for them every year, after November 16 to December 15, they are allowed to enroll themselves for the new following year, for January 1st to December 31st. So through the marketplace, every time we enroll someone before the 15th of the month, they will get the following coverage on the 1st of every month. Okay, the following month. Let's say when they enroll in November 1st, that's for the qualified health plan. They're going to get this January 1st next year, starting their coverage. But for us, for Medicaid, Essential Plan, and Child Health Plus, when we enroll them before the 15th of every month, like this, let's say September 15, they're gonna get October 1st. If we enroll them September 16, they're gonna get November 1st. Okay, so we always tell our client, please reach out to us before the 15th of the month so you could get coverage for the following month. We don't want people to have any gap in their coverage, especially people who they lose their job or they lose coverage through their employers. They reach out to us to run eligibility for them through the marketplace. And if they lose at the end of the month, we need to enroll them the first of the following month right away. So this way they didn't have a gap in their coverage for them and their family members.
Okay, got it. The 15th of every month is the deadline in order to get coverage for the first of the following month,
Yes.
correct? Okay,
Yes,
that
correct.
is good to know. So let's say I've gone ahead and I've applied, I've met the requirements, I'm eligible for many, many plans. How do I choose between all of the plans?
Okay. The marketplace, they have so many options for coverage. There is about 10 plans in the marketplace, some of them for Medicaid Essential Plan and Child Health Plus, and there is extra plans that they only give qualified health plan, which is Obamacare plans. Now, in order for you to choose a plan, you have to find out your doctor and your pharmacist and your dentist which plan they accept, and we help them choose the right plan that's common between all the doctors, because they're only allowed to choose one plan, and each doctor they accept different plans. Now, if you are on qualified health plan, there is over 50 options for you, because each plan it has different level from bronze to silver to gold and platinum. Okay, depends on your budget. When we give you the options, they tell us which planet fits their need and which planet fits their budget, because each plan, the more they pay to reach the platinum, the less deductible, the annual deductible for them. For people who see doctors like on a monthly basis, or they have a medical condition, they need to go for gold or platinum because they don't have to pay too much deductible. People, they like to pay the premium and get rid of the deductibles. Some of them, they can afford it. They choose the bronze, and it's very low premium, but very high in deductible, between $4,000 to $5,000. So it's up to the clients what they want to choose. But we give them all options, and we put it on the table for them, and that's what they go for.
That's great. And I really appreciate you outlining that all. And for any viewers that are watching this and are extremely confused about the terminology that we're using or what a deductible is, just a reminder that being a healthcare navigator can help you walk through all of these steps and explain everything more thoroughly.
And I would like to explain that the income level with the marketplace, it's up to 200%. 138 they get Medicaid, 200% the poverty line, depends on the family size, they get essential plan, which is all free. Anything above the 200% up to 400%, they get tax credit. Actually, in New York State of Health, they help pay partial of the premium for our clients, which is great. Depends on their income and family size. I've seen people, they pay much less than $100 for a monthly premium. And especially if they have medical condition, they don't have to worry about the medical bills. And we know how much to access healthcare, hospital bills, it's thousands of dollars. They can eliminate these bills if they have health insurance. And that's why we advise people why they should get health insurance. And the marketplace is the only place in New York State that they give advanced tax credit to help you lower the premium.
I mean, that's amazing.
Yeah.
And yeah, both of us are on the same page, encouraging everyone to seek out Health Navigator to get health insurance. Yeah. I think a lot of people do stray away from getting healthcare because it seems like this confusing process, but then there's help out there and you just have to find it.
Yeah. Believe it, sometimes they do come back to us and they say, I have thousands of dollars of medical bills. Please give me health insurance. If they're eligible for Medicaid, they retroactive the bills for 90 days if they had it within 3 months. But if they are in qualified health plan or essential plan, only emergency Medicaid will pay the bills. Qualified health plan, they're not going to retroactive the payment for them. So that's why when open enrollment, we encourage everyone, check your option. Okay, if you have medical condition, let us know. We'll advise you and give you the option. We'll eliminate also many options to the plans that your doctor accept and your hospital and your pharmacist accept. And I let them check with their pharmacist, see which plan it covers their medication list. It's very helpful for them.
Say that I'm starting completely fresh. I don't have an existing pharmacist. I don't have a physician. If I have health insurance, I've selected the plan, how can I find where to go?
Okay. Now, depends on your zip code, because you don't want to travel too far when you're sick to go see a doctor.
Right.
When we put the zip code and we find out which hospitals in your area, in New York City or statewide, and we know the doctors affiliated with that hospital, they affiliated with the hospital that's in your area. Okay. And when we give them options for the plans, we log into the plan to see is the hospital and the doctors in your area affiliated with that hospital, which plan they accept in your area. Because each county They have different coverage with the plans.
Right.
Some of the plans all in New York City, like Metro Plus, only public hospitals, and some of the doctors they accept Health First. It could be in New York City and Long Island and Westchester area. Fidelis and Empire, they are statewide. So it depends on the county. The system is so accurate. They give us actually the list of plans covering in your county, in your area, in your zip code. And when you give you the options, and that's how you see you will eliminate the from 50 to it could be 6, 7 plans in front of you. Okay, and depends on the program that what's your need, which plan it will cover the issues, the medical issues that you have.
Understood. So say you select a plan that covers doctors and hospitals that are in your area. How do you find those doctors?
After you choose the plan, you log into the plan site. You put your zip code and which doctor you're looking for, PCP, the physician, or you want dentist, or your eye doctor, or specialties. You put down on the site with your zip code. They will give you a whole list, and you choose within your area, within 5 miles, 10 miles, 3 miles. It's up to you to choose that doctor. So many people they put the language too to find a
Mm-hmm.
doctor who speak their language. It's not easy to understand what the doctor telling you about your health. So it's good to find out what language these doctors they speak. So
Yes.
when you log into the site of the plan, put down all the information you need, your zip code, the language, distance. It will give you a list of doctors.
Yes. And speaking from experience, the types of filters that you can use on these websites are incredibly user friendly. You can select preferred gender of a doctor, language of
Yes,
the doctor,
yes.
distance as you emphasized. So you're able to really get exactly what you need.
Or they could call the plan, because when we enroll them, we give them the plan, the state will send them a letter with the phone number and contact information for the plan. You could call them and tell them, I live in this area, give me a doctor who accepts your plan. Okay.
Yes. All right. So then our last question then is, I'm watching this video right now and I'm so confused. I have way more questions. Who can I reach out to for help?
They could contact me and they could contact the New York State of Health. We'll be happy to help them, direct them. That's why we are navigators, to help them navigate the system. And
Mm-hmm.
plus, being a navigator, we don't just give them the card. We follow up with them. Did you reach out to your doctor to make an appointment and have your annual checkup? It's very important for them to reach out to us. We'll be happy to connect them to any benefits in New York City or statewide as a navigator. Uh, as I said, they could call us, they could call me directly at my direct number, 516-430-7418, or they could email me and I'll be happy to direct them, enroll them, give them a doctor who speaks their language. We'll be happy to help with that.
Amazing. Thank you so much for sharing your information in order to help anyone that needs it. It's greatly
No
appreciated.
problem. We're always here to help anytime.
Are there any other important notes on navigating the healthcare marketplace? Anything that you wanted to emphasize or include?
I just want to say nobody should be fearing to give us their personal information, the services they want, the benefit they need. And they could reach out to agencies from their own community. Like I'm working for the Arab American Family Support Center, but we help anyone. Even I'm Arabic speaking navigator. We help with so many services in our agency, and it's all free and confidential. We even have for new immigrants ESL classes, immigration services, preventive services, mental health services. We can connect them to services they need in the city if we didn't have it. I'm sure they need job placements, housing. We'll be happy to connect them to these services. Do not fear connecting with us. Make 311 in New York City your best friend. They could call them for any services they need in the city. They need anything, just reach out to us. Do not be afraid. Share with us your information. And many agencies in the city, the community-based organizations, they have their own navigators who speak their language. If you're
Mm-hmm.
Hispanic, Russian, Chinese, there is CBOs, community-based organization, who speak your language, and they have their own services for you. Reach out to them. Call us, and we'll be happy to direct you.
That's great. And yes, I want to emphasize your point too, that there are many community-based organizations out there that have healthcare navigators on their staff. And if they don't, I'm sure they're more than happy to make a referral to an organization that does.
Correct.
All right, then. Thank you so much, Maha, for joining us today. You really helped break down this complex and I think overwhelming system for most people into something that's really easy to understand. And I think you really did a great job emphasizing that there is help.
Correct.
So thank you so much for joining us
No
today.
problem. And we only one phone call away, so please reach out to us. We're happy to help you. Can't wait to see 100% enrollments in New York State.
That's the dream.
Yes, that's a dream.
All right, I'm going to go ahead now and share both of the New York Immigration Coalition and your contact information here.
We really appreciate it. Thank you. Thank you.
Of course. So here you can go ahead and reach out to the NYIC. You can also reach out to the Arab American Family Support Center. And as you'll see, we have Maha's both phone number and email included in this slide. And the helpline that we've referenced many times in this video is right there at the end. Thank you so much for joining us.